Thank you very much, Professor Von Braun. And thanks for this invitation to be with this very, very distinguished panel. I do not have any slides to share, but I will maybe in the next 10 minutes or so just share some reflections on the theme of today's workshop. So I want to start with a very quick update on the epidemiology that, of course, we track, the WHO tracks. We get data from all countries, and then we present it by region. The WHO has 6 regions. And what we were seeing over the last several weeks, 6 to 7 weeks, starting from August, was a decline in the number of cases, weekly cases and deaths. However, this started plateauing, and in the last week, we have seen an increase in the number of weekly cases. We're almost at 500,000 confirmed cases per day. So this is in just 24 hours, 500,000 new cases and about 7,000 deaths. And we've averaged between 6,000 and 10,000 deaths a day now for many, many, many months. And we haven't gone below 50,000 deaths a week now for more than a year, since October of 2020. So while there is a tendency for people to think that this pandemic is coming to an end, or we're getting to the end of it, I think we have to be very clear about the message that we are nowhere near the end of the pandemic. When you still have 7,000 to 8,000 people dying a day, and I must emphasize that these are reported and notified cases, which means that these are people who had a diagnosis of COVID. We know that the true burden of cases and deaths is much higher. So when we say we have 250 million cases and 5 million deaths now that we know about, we have to multiply that number several times, and models have predicted that the deaths may be about 3 times higher globally. But clearly, again, this depends on the systems in countries to document deaths and causes of deaths. So while in the very high income countries, which have good notification systems, they pick up, and also countries like South Africa, which have really built very good civil registration systems, they pick up most of the deaths, even if they may not have all the causes of death. But in other countries, deaths occur at home, they're not notified, let alone analyzed for the cause of death. So we have big gaps in our knowledge. And I should also add that WHO has noticed that only about half the countries give us data which is disaggregated by age and sex. So it becomes very difficult in many places to know what's actually going on the ground. And so, brings us back to a very basic issue of strengthening health systems. Health systems need to be able to at least document, births, deaths, and causes of death, because without that, one doesn't understand the burden of disease in the country. The regions that are showing an increase in cases of late over the last 2 weeks or so, basically is Europe, specifically Eastern Europe, and also the Americas. The Americas, unfortunately, have been impacted a lot. Africa is always, the numbers are always very low, but again, that is a reflection of the very low testing that goes on. And recently, our African regional office said that 5 out of 6 infections in Africa probably go undiagnosed and unreported. So I think that's the first message that I wanted to give. Now, people may ask, what's driving this increase in cases, particularly in Europe and the Americas? And I think there's a combination of factors here. One thing that is clear is that being vaccinated protects individuals from getting severe disease, even if they get infected, and being hospitalized and dying. And therefore, in countries with high vaccination coverage, you start seeing a mismatch or a break between cases and deaths. So pre-vaccination era, increasing cases would automatically translate into increasing deaths. Now, if you have a highly vaccinated population, infection may spread because of the Delta variant being highly transmissible. This is not translating into the same high rate of deaths, though of course deaths are occurring and will continue to occur as long as this infection circulates. In parts of the world where there is less vaccination coverage, more transmissible variants, and we know that Delta is the most transmissible variant that we've seen till date. And as you know, we have 4 variants of concern: Alpha, Beta, Gamma, and Delta. All of them showed increased transmissibility compared to the wild type, the Wuhan strain. But clearly the Delta 6 to 8 times more transmissible than the original strain of the virus. Therefore, it spreads very quickly within households and also within communities. So that's the variant definitely has an impact on, and parts of the world which are still seeing Delta surges are seeing this increase in cases. The second is increased social mobility. We've seen, of course, in many countries now, restrictions are lifted. We saw the stringency measures. Some countries had very stringent measures in place, but no country has been able to sustain that over such a long period. And there is fatigue among people, and also economies, education, etc., need to open up. And so this results in social mixing. But to add to that is the inappropriate or inconsistent use of the known public health and social measures that we know reduce transmission, like the wearing of masks, for example. Many countries lifted their mask mandates. They lifted other restrictions like gatherings and mass gatherings and people gathering in indoor settings and so on. And so when all of these things are lifted, and people who are vaccinated and unvaccinated and infected, uninfected are all mixing together, the chances of infection rates going up definitely. And we've seen this in many countries, and many countries are now walking back and reimposing mask mandates and other more stricter measures. And then the final variable is the amount of misinformation and disinformation and politicization of the pandemic itself. This obviously results in trust was mentioned as a very important element, trust of people towards their government, towards institutions, and believing in the public health messaging that's coming from government, believing in the vaccines that are being distributed. All of these have played an important role also in how countries have done and what we are continuing to see. Now, on the science side, of course, we've seen tremendous advances in terms of genomic sequencing that allowed the first vaccines and diagnostics to be developed, but also the development of vaccines, of other therapies like monoclonal antibodies, and now hopefully of small molecules, antiviral drugs that can be given to individuals who are infected early enough to prevent the disease from progressing. So on the science side, tremendous achievements built on decades of progress and investments in new technologies, mRNA, the adenoviral vectors, etc. Also great collaborations, I think, global collaboration, open sharing of knowledge and data, the fact that we have 4.5 million whole genome sequences today on this platform called GISAID, which allows us in real time to track viral evolution, as well as all of the journals putting their COVID-related publications, making them open access. All of these things have helped really into quick translation of knowledge, making it available. Now, it's another matter whether that knowledge has been used wisely and appropriately, and by translating them into guidelines and into policies, and those policies being implemented. There, I think we have seen gaps. So the WHO, very early in the pandemic, convened a global community of scientists, came up with a research roadmap, identified research gaps, set out target product profiles for vaccines, drugs, and diagnostics, and continued to convene very frequently thousands of scientists from around the world in different thematic areas to discuss progress. And we have regular webinars, workshops, seminars, etc., both to share information, but also closed working groups to advance the science. And we've also moved into a system of living guidelines where we continuously update our guidance based on the most recently available research data. So our therapeutic guidelines, for example, have been updated on a very regular basis. we have from the beginning recognized that there will be many ethical issues that will come up, and therefore it wasn't only scientists who have been meeting and discussing, but also a bioethics working group composed of experts from around the world who have come out with many guidance documents, including on things like the ethics of using contact tracing apps. We know many countries, have used these and have collected a lot of information from citizens. The ethics of mandatory vaccination, for example, the ethics of human challenge studies, and of course, on an ethical framework for equitable access to vaccines and other health products. Now, these are all guidance documents. They're frameworks for scientists as well as policymakers to consider when they're taking decisions. And I do think that that's been a very helpful part of having a sensible discourse. Then, of course, we come to the equity issue. Just before I come to equity, I think a few lessons that I personally have learned over the last 22 months or so has been that while we made best efforts to coordinate the scientific advice and efforts, there were some gaps. I think there was too much of duplication of effort at the beginning, not enough coordination, and probably a lot of wasted resources spent on clinical trials that never resulted in any good answer to any question. So in a pandemic, definitely, I think we need better global coordination. We also need a roadmap for how the private sector engages during a pandemic, and particularly when there's a lot of government support going into the private sector to support the development of health products. What are the equitable access provisions and clauses that need to be put into the contracts so those products that are developed using taxpayer funds are then treated as global public health goods? I don't think we have clarity on that, and hopefully the discussions around the pandemic treaty or agreement could address some of that. And then I think the concept of the platform trials, there were several platform trials, including the solidarity trial stood up by the WHO, that proved to be the most rapid, efficient way of actually gathering information on the efficacy and safety of drugs, potentially of vaccines and other health products. So I will just end with consideration that while all of this progress has been, absolutely laudable, what we haven't seen it translate into really is equity in access, despite the fact that WHO from the beginning attempted to address that problem by setting up the ACT Accelerator, the COVAX facility for procurement and distribution of vaccines to all countries, and particularly the low-income countries. But many issues, including manufacturers and suppliers prioritizing countries which were paying in advance and paying more. There were export restrictions. Many countries put bans in place or put restrictions on movement of both vaccines as well as of ingredients and consumables that resulted in supply shortages. And thirdly, countries of vaccine nationalism, it's been described as where countries have only thought about their own citizens and not about the world as a whole. And we know that that is not the way to deal with a pandemic, that as long as the virus continues to flourish in some parts of the world, it's going to come back. It's going to have increased opportunities to mutate and become even more infectious or more vaccine resistant mutants, hopefully not. But that is a scenario that one cannot rule out. So at this point of time, we are very much laser focused on trying to expand vaccination coverage, where we see that some countries are at 70% and more, and other countries are still at 3, 4, 5%. And it's the supply issue, that's the major issue, but some countries do need more than just the supplies. They will need support with rolling out their vaccinations. I will stop there, happy to answer any questions.
Thank you.